करना है।
हो गया स्टार्ट। चैट कहाँ देखी?
गुड मॉर्निंग। यहाँ देखो। Good morning, everyone. How are you? How are all my hardworking students? Good morning. Let everyone join in. Good morning. Good morning. I'm very good. I'm very good. Good morning. So how are you finding your preparation? कैसे लग रहा है? Like how tough or easy the preparation is? Some of you must have done little bit subjects by now. So how are you finding your preparation? Is it easy? Is it doable? Is it interesting? Or हमसे नहीं होगा मैम? Yes? Yes, bete. Till now, how many of you have done at least 2 or 3 more subjects? Good morning. Good morning. Just started. Interesting. Yes. And you know what is more interesting? Lot to remember. Yes. 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 But Dr. Haith, Gujarati होके हम ये नहीं कह सकते ना, Gujaratis have a good memory. So you have to now prove that Gujaratis have a good memory. Good morning. Good morning. Good morning, everyone. Okay, so since it's the first class of Physio and Medicine, let us first start with a song, okay? All of you, I know you are. Revision is difficult, Dr. Kashish. Revision ke liye we are there. We'll make you learn things. Right? I'm just going to tell you the rules and everything, what you have to do in order to get a seat. See, beta, this is a game. As simple as that. Your NEET PG exam is a game. Right? Every game, even, you know, the snakes and ladders has rules. Snakes and ladders is the simplest of games, but still it also has rules. Right? And unlike snakes and ladders, here, you know, destiny dependency is less. Your whatever hard work you will do is going to make a difference. So first thing I want from all of you, one, are you here to get a seat or just to study? Batao, jaldi batao. Let us in 5 minutes start the class. Are you here to just study, just enjoy, just give a try, or get a seat? Jitne bache, I want everyone to reply. I want just everyone to reply. Seat, government seat. Seat nahi hai, government seat. Right? All of you should have this in mind. Number one, you are here not to study physio medicine. You are here not to study endo. You are not here to enjoy the oral surgery class. You are here to get a common seat. Fine? And like I said, it's a game, so there are rules. Anybody who gets what the rules are will get a seat. Next, we are going to give our 200, 300, 400, 500%, whatever we can do to make you near that seat, right? Whatever, suppose you are thinking, ma'am, I am going to get rank 20. I am going to make all efforts so that you reach near 20, right? You reach near 20, but the 20th rank is going to depend upon you. Right? It is not going to depend upon my teaching or my quizzes or my presence. It is going to depend upon how you study when the class is over. So next question, everyone. I'm going to give my 500%. Are you ready to give me your 200%? If 100% is the commitment, then again we are out of the race. 200%. We are going to only think, eat, sleep, and dream and work for MDS. So next question, are you ready to give me your 200%? No excuses, nothing. You know, even if there is an earthquake coming, right, and you are in the middle of an earthquake, and I ask you, beta, you want to study? Your answer should be yes, ma'am. If I don't care if there are floods, if of course if there is a life threatening situation health wise, there is only one thing which I'm going to give you as a relaxation, and that is if your health is a problem, right? And of course if somebody's health in your family gets a little problematic, then okay, relaxation. Otherwise, any problem, ma'am, my HOD is bad, ma'am, my friends are not able to support me, I am feeling depressed, I am feeling anxious, no excuses, just plain study. I don't mind if you cry. See, everybody cries. You cry for 1 hour, you call me, but the next hour you are sitting. Correct? So let's start with the song and then rules, and then let's start with the class. You know, all of you know this song?
यही रास्ता है तेरा, तूने अब जाना है। हाँ यही सपना है तेरा, तूने पहचाना है।
Come on everyone, get in the tempo.
यही रास्ता है तेरा, तूने अब जाना है। हाँ यही सपना है तेरा, तूने पहचाना है। तुझे अब ये दिखाना है।
This is my favorite part. See everyone, anybody who stops you, anything that stops you, you are not going to stop. Simple rule, the first rule of my class is you are not going to stop. Right? Whatever may happen in the day, your studies are not going to stop. Right? Let me just... Right? Whatever may happen. Okay, so whatever may happen during the day, if your timetable is not done, you are not going to sleep. Fine? Chalo. So what are the rules for the medicine class? One, you have to learn with me right now in the class. You are just going to revise at home. Learning will happen right now. Right? Before every medicine class, I will take a 5 minutes quiz of the previous class. So previous class has to be on tips. And for the previous class, I don't want you to spend a day. Right? You will learn with me and only in 10-15 minutes you will revise. Next, every time you come to my class, you do not have to think you cannot do it. It is very bad. I don't stand a chance. I am a mediocre person. I am a very, very high person. But the people, you know, somewhere are even more intelligent than I am. If you think like this, you will not attend my class. Simple rule. Simple rule. If you think you are not made for NEET, then beta, my class will not help you. Right? My class will help you if you have even a tiniest belief that you can do it. Right? Then we will make it happen. Next, more study. You are going to study. And yes, you are going to enjoy also. You are going to take care of your health also in this 1 year. You are going to do everything that is possible to actually become successful. Whatever it takes. Right? Health-wise, study-wise, mentally, everything. Now, I want one notebook for your notes. Then there are 2 more notebooks, everyone, which you will make. 2 more registers. One is a Dr. J notebook, in which we will add all the tables and everything that I am going to give you. And Dr. Q notebook is for quiz. So when I take the quiz, all the important points you are going to write in that one small notebook. Next, bete, How to study all the basic subjects, all the P plus M. First point, we are not going to master them. No mastering of any subject. You are not going to master your dental or medical. You are going to study retrograde. What does that mean? That means you are not going to open up any book except for the retrograde study. Suppose in pedo you do not get cerebral palsy. You are not going to open whole McDonald's wala jo book hai. No, you are just going to open the page 251 where cerebral palsy is there and just read that paragraph. Okay? So retrograde study. Similar thing applies in your basics. In basics, no book required. No book required. One, you are going to do the questions on the app. Second, you are going to learn the notes. Right? And third, you are going to do the quiz. So by the time we finish our basics, everything will be clear. Right? No book is required. Nothing is required. Right? Pulse, if you are doing good, just practice. Pulse questions in basics are not that good, but still do them because we have to keep on doing the MCQs. Right, everyone? So with this, let us start with liver. I will come to this line later. Now let us first start. Now everyone be attentive. Be attentive, everyone. Okay, let us start. First is liver. In liver, as I said, we are not going to follow any sequence in any chapter. The sequence is importance-wise. Number one. So let us first start with Wilson's disease. Let's start, beta. Let us begin. Come on. कॉफी शॉट होता है वैसे ही मेरा शॉट आने वाला है एवरी क्लास में लाइक वी टेक कॉफी शॉट कैफीन शॉट वी आर गोइंग टू स्टार्ट आवर क्लास विथ थिंकिंग वी आर रैंक 1 2 3 fine. Now Wilson's disease, very easy, just learn with me, everyone. Just learn. See beta, first understand, then I'll give you time to learn. First is, it is autosomal recessive. Important question. The two diseases that I'm going to teach you right now, both of them are AR. Next, what is the basic defect? What is the basic defect in Wilson's? In this, there is decreased excretion of copper. First thing, let us not write, don't write it. First understand. Copper is not being excreted from the liver, right? From liver. During the blood circulation, it reaches liver, but the liver now cannot throw it out. So what happens? Liver becomes a lock for copper. Clear? This much point is clear? Now, bete, what happens? Now, this liver is going to be exploded with copper. Correct? Eventually, what will happen? There will be more copper in blood, but temporarily. Temporarily. Okay, understand everyone? Then I'll give you 5 minutes, you write down. When copper is more in the blood, in our body, we have ceruloplasmin. What is this? A protein that binds copper. This is going to bind to copper, and what will happen to the serum ceruloplasmin levels? They are going to decrease. Right? Obviously, there is a protein which is going to bind to copper. So when all the bindings happen, the serum ceruloplasmin is going to decrease. And any protein, everyone, which is synthesized by the liver or anywhere, takes time. Protein synthesis takes time. So it cannot be replenished very quickly. So serum ceruloplasmin is going to decrease. Serum copper also now is going to decrease. Correct? Next, there is going to be copper excretion. More and more of copper is coming into the body. What will the body do? It will try to save, right? It will try to save itself. So it will throw the copper from the kidneys. So more copper excretion, right? But since it is AR disease, there is a mutation, it cannot be stopped. So more and more of copper is coming. Now, beta, this excess of copper will go into many places. Please write till here. I'm giving you 1 minute. Please write till here. Please write till here. Please write till here. Autosomal recessive, the two diseases, Wilson's and hemochromatosis, both are AR. ठीक है, तो ऐसे याद रखेंगे. And this is very important. Then I'll tell you certain additional information. First, you write this. Write this without looking at the board. Easy. Medicine is maths. If you know what is the defect, you can make a flow chart. I'm going to teach you medicine and physiology as a flow chart and not as you have to learn this. Right? Have you written till here? Give me a thumbs up. If you have written and understood till here, give me a thumbs up. Very good. Now, one extra information. This defect, why is it happening? This defect is happening because on chromosome number 13, ATP7B gene, this is a rectification. ATP7B gene is mutated. And this gene controls copper excretion from the liver. So one very important question, let me ask you. What is the most common or most first, let us say first organ affected in Wilson's? Jaldi answer. Topic is Wilson's, bete. So tell me, which is the first organ affected in Wilson's disease? First organ, everyone. I want the answer. Very good. Right? Just hold on to this point. Now, everyone, excess copper is in somebody's body. Okay, this is the person Ramu. So let us meet Ramu. Ramu is going to have every medical disease that I'm going to teach. Okay, so Ramu, but still Ramu is a fighter. Ramu has been alive since so many years and he has had every disease that I have ever taught. So he is one of a fighter. Okay, so meet Ramu. Ramu has Wilson's. Now this Ramu has lot of copper in his body, lot of copper. Copper is joining to ceruloplasmin. Copper is even coming out in the urine, but still more copper. Still more copper. So now this copper will go to Ramu's brain, eyes, kidney, organs. Right? Now, when copper goes to the brain, it goes into the basal ganglia. And this, you all know, basal ganglia, एक disease है Parkinson's. उसकी site है. So anything wrong that happens to basal ganglia leads to Parkinsonism like symptoms. It is not Parkinson's disease. Parkinson's disease is different, right? It is Parkinsonism's like symptom. And what are the symptoms? Tremors, dysarthria, dysphagia, No need to write it. Drooling, poor handwriting. No need to learn it. You can write it, but this should not be learned right now. Why? Because when I teach you Parkinson's, we will learn everything. Fine. So this is not to be learned. But what is to be learned? That when copper goes to brain, it causes Parkinsonism-like symptoms. Poor handwriting, right? There is like mask-like face. These are the symptoms of Parkinsonism. Done? Okay. Next, when it goes to the eye, it causes sunflower cataract. Obviously, copper will go to the eye, it will get deposit, cataract will happen. But the name is, it will form sunflower. Copper color क्या होता है बच्चों? What is the color of copper? That kind of color is going to come into the eye cataract. Sunflower. Next, the KF rings. Please circle KF rings. The KF rings, they are Kayser-Fleischer rings. Very important question. Now these KF rings, please listen carefully, then you write. They are not characteristic. Question आएगा characteristic. But they are, if, what do I mean by that? For you, if somebody gets a Kayser-Fleischer ring, it is Wilson's, right? But are they specific for this disease? No. They are found in many diseases, right? So what all other disease I can find it in? I can find it in Wilson's, biliary cirrhosis, and autoimmune hepatitis. You do not need to learn these diseases. Why? Because question can come, is KF ring the only feature which can tell a diagnosis of Wilson's? No. It is not a diagnostic. Correct? So this line will come as true and false. KF ring may be characteristic. Yes, in 60% cases, we will see the KF rings. But if KF ring is absent, it cannot be said that Ramu doesn't have Wilson's. KF ring is not a diagnostic of Wilson's. It is a corrector. Done? Next, everyone, what is KF ring? Again, a very important question. This is copper deposition in Descemet's membrane. There is a membrane of cornea. This is the name of the membrane. And what kind of a ring is it? I'll show you. It is either brown, gray, greenish ring in the eye. So what are the important questions, everyone? Let us learn. First, when it goes to eye, it causes KF rings. Sunflower cataract is not that important question. KF rings, repeat question. Where is it seen? It is seen in the Wilson's and also other diseases. So yes, characteristic but not diagnostic. And where it is deposited? Copper deposition in the Descemet's membrane of cornea. Very important question. And let us see the image. See this eye, beta. When in your exam, a diagram of eye comes, and this kind of beautiful ring, brownish, grayish, greenish ring is there. This is a case of Wilson's disease for you in your exam. Until and unless the examiner wants you to know other options as well, which I have taught you. But I don't want you to learn them. So everyone, I'll be giving you the images as well. Please keep on sticking in your notebooks. Okay. Next. This also goes to kidney, right? Copper will go to kidney, and when copper goes to kidney, it is going to damage the nephrons, damage the blood vessels of kidney, and we are going to see hematuria. What is hematuria, everyone? Hemat, blood, urea, urine, blood in the urine. And there is also going to happen nephrocalcinosis. No need to ratify this. Simple hai, copper gaya hai. Copper has gone. It will injure the blood vessel. Second, it will cause the calcium to deposit. It will cause the stone to form. So no ratta required here. Next, when it goes to the genitals or it goes to the urinary system, it is going to cause a lot of problems like decreased sex drive in females, recurrent abortion because copper is going to destroy the vessels, and plus emotional depression, emotional anxieties, and all that is also going to happen. Right? Next, special case, what is going to happen to the nails? When copper goes to the nails, it forms a special azure nails. Everyone see your nails? There is a moon present like this. Right? So the moon of nail becomes bluish. That is your azure nails. You will not get the nail wala diagram. Nail image will not come in your exam. You are sure to get KF rings and the lab of Wilson's and the gene, or whether it is autosomal dominant or recessive. Okay. Written, everyone? Next, copper is there in the blood vessels. Right? And in the blood vessels, we have RBCs. Imagine copper is floating with the RBCs. So what is going to happen? Clash, 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 accident. RBCs are going to break. This is known as breakup anemia or hemolytic anemia. Lytic mane breakup. Hemo mane RBC. Breakup anemia. Which you will not understand right now, but just write down. Coombs negative. When we do RBCs and when we do anemias, I will teach you Coombs positive and Coombs negative. Right now, you just write it. Right? So please remember, take a minute and learn this chart. Take a minute and learn this chart. Quickly, what all is happening here? Please make a chart. And then you are going to teach me the lab report. I have no idea about the lab reports. You are going to teach me the lab reports. All of you are going to teach me. Okay. Done. Let us start. What is going to happen to serum copper? Let us start, everyone. I want you to teach me this. Quickly tell me what is going to happen to serum copper. Eventually, everyone will say, ma'am, you said temporarily increase hai wo. अरे वो temporary है. Temporary is like in a flash of seconds. It's temporary. Majorly, when a patient comes to you with all the features, you will see decreased serum copper. Very good. Tell me, what is going to happen to the ceruloplasmin? Ceruloplasmin, again, a physiology question. It binds what? It binds iron, it binds copper, it binds zinc, it binds what? So ceruloplasmin is copper binding protein. Serum ceruloplasmin, decrease. Urinary copper, copper in urine, increase or decrease? Very good. Very good, everyone. See, today's class is the starters class, right? We are going to start and build up for the future. Liver is very interesting, scoring, and easy. Right? So we always start with liver because from liver you are going to get 4 questions. Minimum 2 questions. Right? Very good. Is there anyone who is not able to give me answer for this? Anyone? You can raise hand without any feeling of, anything. Just raise your hand, ma'am. I'm not getting it. I will explain. Next, what will happen to the liver copper? Suppose I open the liver, I do the biopsy. What am I going to see in the liver biopsy? Copper increase, copper decrease. Very good. Okay, now MRI phase I'm going to tell you. This causes a characteristic panda face. Correct? So beta, this information very important because this will come as it is in your exam. What is this? After the class, I'm going to share certain important questions of Wilson's and hemochromatosis on your WhatsApp group. Answer karo khud. See if you can answer or not. Next, investigation of choice. Investigation of choice is going to be liver biopsy. Why? Because even if it doesn't go to the eye, it doesn't go to the brain, it is still present in the liver. Liver is the first main organ to be affected by Wilson's. Okay, so liver biopsy with quantitative copper immunoassay. Now, no need to learn this, but this thing will come in your exam in the option, कि liver biopsy or serum copper. So this should not confuse you. Okay, what is this quantitative copper immunoassay? That means how much copper is present in the liver. It's not qualitative. It is quanti. How much is present. Right? So no need to learn this line. I'm cutting it. But if you find it in the exam, in the option, do not get confused. Next, everyone. Now, Ramu has come to you. How will you manage him? Right? So, first one, zinc acetate. Everyone speak with me. Zinc acetate is the drug of choice. IOC and DOC. What is IOC and DOC? You have to learn right now. Investigation of choice, drug of choice. Zinc acetate, zinc therapy with a chelator. That is your therapy. Now here I want all of you to learn 2 words. Just know them. One is hepatic decompensation. With hepatic decompensation and without hepatic decompensation. Now, see beta, liver is a miraculous organ. If I leave only 1/16 of the liver, still it can regenerate. Right? So it is such a miracle. It's like the lizard of our body. Right? How the lizard can form its tail, our liver can regenerate. Right? So 1/16 also of the liver can regenerate, make full. But if the damage is very, very, very high, right, then it undergoes decompensation. Now the liver says, sorry, bhai, now I can't compensate anymore. So decompensation. Right. Now, with hepatic decompensation means the liver is now truly, completely on the verge of dying. So here, zinc acetate plus we give a chelator. Without hepatic decompensation means liver says, I am still strong, but give me some medicine. We give zinc acetate. We give zinc acetate. Yes, doctor. Yes, correct. Correct. Dr. Mokhtar, beta. Dr. Desha has just explained to you. Do you want me to explain it again? I will do it after the management. Understood? So when it is decompensating, we want something more drug. And what is that drug? D-penicillamine. D-penicillamine. So penicillamine is a pharmac question. It is a copper chelator. So see beta, in medicine is not only medicine. You know, there will be certain people even on the YouTube, even elsewhere, who will say medicine for the NEET PG not important, just to the important question. But medicine will teach you pharmacology. Right? So very important, physio, medicine, pharmacology, they are very important. 3 subjects which will fetch you your rank. Right? Pathology, less important. Microbiology, important but difficult. So we don't worry about the difficult in the paper. Right? Okay. Let us see. Correct. Chelator. Very good. And beta, zinc acetate, if they ask you what is the drug of choice, it is not penicillamine. It is zinc acetate. If zinc acetate is not in the option, then penicillamine. Getting my point, beta? So when you are giving a MCQ based question, you have to first mark what is the most important. If that most important is not there, then second most important. Okay. Next, if somebody has neurological manifestations, neurological manifestations have started, tremors are there, forgetfulness is there, person is not able to speak, not able to gulp the food, right? Then we add one more drug, that is tetrathiomolybdate, right? Next, everyone, make a box. There is a score. What do I mean by score? You all have done scores in your perio, PhD, kiya na? What is a score? We measure how much the disease has progressed. So for Wilson's, we have Nazar's index. Nazar's index. In this, we measure how much is the bilirubin, how much is the PTINR, and how much is the AST. AST you will know by the next class. PTINR next class. Bilirubin next class. These are the scores. These are the blood tests we do to know how our liver is functioning. So Nazar's index, this name is important. And more than 9, we just do liver transplant. And less than 7, we manage by medical therapy. So everyone, what is important in the Wilson's? Let us revise again. First, AR, ATP7B gene, chromosome 13, lab, you have taught me yourself, KF rings, sunflower cataract, hematuria, wherever copper goes, deposits, azure nails, and hemolytic anemia. Lab reports, I know you know it. What is the investigation of choice? You know, liver biopsy. What is the drug of choice? Not penicillamine, but zinc acetate. What is the copper chelator? Penicillamine. Fine. Next, what is the score? Nazar's index. Next, everyone, we are going to do the twin disease. Any doubt in this? Always with zinc acetate. Always. See, the drug of choice is always given. Right? If somebody has fever, paracetamol is always given, no? Correct? Then you give something else. If it is an infection, viral, fungal, bacterial, what it is, you take out the drug for that a little later. But first drug, fever, paracetamol. So first drug, Wilson's zinc acetate. Done? Now let us do the twin sister of Wilson. Twin hai, but fraternal, not maternal. They don't resemble but they are almost the twins. Now, first thing, it is also AR. Both the diseases are AR. Next, it is happening because of HFE gene mutation. This is Ratta on chromosome number 6. That was ATP7B on chromosome number 30. Almost half of it is chromosome 6. So HFE chromosome 6 half ho gaya, almost half, right? In that Wilson's we were having copper deposition. Here hemo means iron. So now the poor liver has a lot of iron. A lot of iron. Right? So what is the problem? Iron deposition in a liver. See better now, you know Wilson's, you can easily do this. Right? Now what happens again? Iron in the liver is going to explode. It comes into the liver, from the liver it will come to the blood. Now in the blood, what is going to happen? Like ceruloplasmin, we have one protein, transferrin, that is going to combine with all of this free iron. Same situation, same story. But there we were using serum ceruloplasmin. Here we do not measure transferrin levels. Level measure we do not do. What we measure? Transferrin saturation. Right? It is just like, okay, we are not going to measure how much transferrin is there. We are going to measure how much of it has been combined with iron. Right? So when iron binds to a lot of transferrin, obviously the saturation is going to increase. It is going to become saturated. Suppose this is the protein. It is going to become saturated with iron. How much is saturated? We measure. Fine. And this is the first marker. Of hemochromatosis. So if you are suspecting, we will do a blood test. We will not see how much of transferrin is left. Right? We will not see that. What we are seeing instead, how much of transferrin in the body is saturated. So one difference. Right? Now let us see the organs. As usual, the first organ which is affected is liver. First organ. Beta, all of these are the questions. Which is the first organ affected? Liver. So what is going to happen in this? There is copper deposition, iron deposition. What is going to happen? Simple. Let us not learn, just understand. There is going to be hepatomegaly. Liver is going to be enlarged. If not controlled, cirrhosis. And if not controlled, hepatocellular cancer, hepatoma. Now, this is one difference, everyone, from Wilson's. Please write here that in Wilson's, we do not see HCC or cancer. Please write in Wilson's, no cancer. But in hemochromatosis, hepatocellular carcinoma can occur because iron is more damaging than copper. Right? So, second difference. First difference was transferrin saturation. Second difference is that liver is affected. Yes, everything is same. That liver is going to have high enzymes, hepatomegaly, cirrhosis, but cancer may also develop. Next, see bete, anybody who takes a lot of iron, the second organ affected is always the skin. You know, when we give the IV treatment of iron also to pregnant ladies or to anybody who has iron deficiency, iron loves the skin. Somehow it just gets deposited in the skin, right? And this is going to give bronze discoloration. I'll show you. In the neck, dorsum of hand, genitalia, lower legs, right? Wherever the deposition occurs, it is going to give bronze discoloration. So this is the second most common organ affected. First, liver, skin, second. Copper doesn't go to skin. Copper goes to brain. Right? Third, pancreas. The third most common organ affected in hemochromatosis. When anything goes to pancreas, it will hinder the insulin. Right? So it is going to lead to bronze diabetes mellitus, bronze discoloration, bronze diabetes mellitus, name given. Right? So the first organ affected is liver. Second, iron loves skin and iron loves pancreas. So liver, skin and pancreas. Next, it will also go to the joints. Iron loves, you know, the outer wala skeleton, the skin. That is like actually, you know, the infatuation of iron. Iron will not go to your eye. Copper goes to the eye, copper goes to the brain. Iron will hit the skin, the joints, the bones. Now the joints show arthropathy. Arthro means joints, patho means disease. Second, I'll show you the images, don't worry. Second and third, metacarpophalangeal joint, MCP joints, are first to be involved. Arthropathy and which joints, see beta, whatever I'm making you write, that is important. That is the direct question. Next, heart. Iron will go to heart, overload will happen. So CHF, congestive heart failure. Iron will also go to the gonads and to the pituitary and to the hypothalamus, and it will cause hypogonadism, small sex organs. Right? So have you seen iron does not go to the brain and to the eye, it doesn't go. So this is the difference. Doesn't go to the brain, doesn't go to the eye. This is the difference with the Wilson's. And plus it hits the skin, it causes diabetes. See, even copper can lead to diabetes, but at a very later stage. But iron, it loves your skin, loves your joints, loves your pancreas. Okay, let us see the images, everyone. Then you will understand better. See here. See here. Can you see? You will get this image. Tan bronze. It's like tanning has been done. Tan bronze pigmentation. Plus, do you see these crooked fingers? See, these are straight, but these are crooked fingers. Arthropathy. You get this diagram. Hemochromatosis. Next, see here, everyone. See here. Make a finger like this. Make a finger like this. Everyone, make a finger like this. This is eagle beak shaped deformity. Eagle beak. Remember how the beak of eagle is? Everyone visualize. So if you get this hand x-ray and there is an eagle beak, this is not rheumatoid arthritis, osteoarthritis, specific eagle. So this is hemochromatosis. Right? The second and the third metacarpophalangeal joints are the major joints to be affected. See here, everyone. Again, this is a very famous image. This image only comes into your exam. So first thing you see, jaundice in the eye. Do you see jaundice? Liver, liver, liver. Next, what do you see? Whenever they show you like this, they are trying to show you the discoloration. The discoloration can be because of Addison's. See, diseases which you have to remember for discoloration. Addison's, hemochromatosis, and jaundice. That's it. 3 which are important for us. History, if they give you history and you see iron related problems, hemochromatosis. If you see adrenal gland related problems, Addison's. Right? So this image will come, they will give you a history that iron is there, and then you know what they will ask you? What is the first lab change that happens? What is it? I just taught you first lab change kaun sa hoga? Yes? Tell me everyone, first lab change I just taught you. Please tell me first lab thing. Yes. More than 45% of the transferrin. See, I'm giving you the number now. Normal transferrin saturation is 45%. In you and me, 45% of our transferrin is saturated. But in this person, more than 45%. So more than 45% transferrin saturation is the earliest biochemical marker. If they ask you phenotypical means what am I seeing? So earliest phenotypical is your bronze discoloration. No need to learn, right? You don't need to learn it. दिखेगा क्या? What will you see in a patient? You will see bronze discoloration. What if you take a blood test? Transferrin saturation. Next, increase ferritin. What is ferritin, everyone? Ferritin is the storage form of iron. So when iron rises in our body tries to store it like ferritin. Right? Suppose you have a lot of water. So how will you store a lot of water? You will make ice cubes. So iron ka ice cube is ferritin. But again, investigation of choices. What is the investigation of choice? It is the liver biopsy, because liver is going to be more first affected, and iron is deposited in the liver. Correct, everyone? Same. So, liver biopsy, both are autosomal recessive, both are, leading to hepatomegaly, jaundice, cirrhosis, but cancer occurs in hemochromatosis. Eyes are affected in Wilson's. Correct? Next. How do I treat it? Very simple. No, iron is there. I need to remove it. Simple. So one thing what I do is phlebotomy or venesection. What does that mean? I remove some amount of blood and I free it of iron. Right? That is the first line, first treatment given to this person. I have to remove some blood. 500 ml of blood has to be removed so that iron moves out quickly. And it is a weekly thing. So weekly venesection, weekly removal of some blood. Second, yes, chelating agents. But beta, as I said, iron is very, very tough agent and iron is very harmful agent. Right? So first thing is I have to remove blood. Suppose 5 liters of blood is there. I am going to make it 4.5 liters. So that automatically less iron is there. Chelating agents very important. Please write down desferoxamine, deferriprone. These are the 2 iron chelators. Right? Now this is again a pharmac question. First thing, this is IV. And please everyone say with me, deferriprone. O. Just make a O in your mouth. Deferriprone. So this is oral. The other one is IV automatically. Right? This is how you have to learn it. And why I'm making you do this exercise? Because this is a question, 2 questions. So everyone, let us make a box. Pharmac questions. Which is the IV iron chelator? Which is the oral iron chelator? So IV or oral iron chelator, that is the first question. So I've taught you the trick. Deferriprone, O, and desferoxamine is IV. Next question. In acute iron poisoning, what is given? See beta, rule. Let us learn a rule right here, right now. If there is an acute condition, can I give oral? Oral has to go to the tummy first, then to the blood, then act. Any acute condition, anything which is to be controlled right now, I always give IV in any acute poisoning. Right? So beta, for acute iron poisoning, the agent or the drug of choice is desferoxamine. Whereas for chronic, we give oral. Right bete? So chronic, ये बहुत important point है. This is very important for your pharmacology questions as well. In any acute thing, poisoning, we are always going to give IV agents and not oral agents. So 2 questions of pharmac, 2 PYQs of pharmac. You have to learn here with medicine. Right? Please learn it. Next, everyone, see, this is a very, high yielding PYQ. Always comes in your INI, always comes in your NEET. You cannot forget it. Penicillamine, diferiprone, or desferoxamine. Next, once the treatment has been given, you have given the iron chelator, you are giving the venesection or the phlebotomy or the removal of blood. Most common cause of death in treated patient. You have treated the patient with every drug that is possible. You have done. Still, beta, the patients are going to die. Why? Because of cancer, hepatoma, HCC. Right? I taught you this. Just give me 1 second. I'll just open up the app. Yes. Yes, Dr. Kashish, lifelong. Obviously. Next, most common cause of death in untreated. Suppose I don't treat a patient. Untreated patient, I taught heart iron. Iron cannot be handled by any organ. Iron is very harmful. Beta, even in RBC, iron is inside the hemoglobin. It is enclosed. Right? When I do hemoglobin structure with you, I am going to teach you iron is enclosed. So iron is very bad. Iron and hemoglobin both are very bad. They are like toxins to our body. Right? Okay. Next, beta, make a box. Microbio question. See, this is not medicine question. This is a microbiology question. Repeat PYQ. There is a patient who has been given whole scenario about hemochromatosis. Fine. And they ask you which organisms will grow in him, because his body is like iron overloaded. So the organisms which grow in iron-rich environment are Vibrio vulnificus and Listeria. Listeria is very important. Monocytogenes and Yersinia. They all are Sidero. Sidero means iron. Philic, love. They love iron. Organism. So, beta, 2 questions from Pharmac, 1 question from microbiology. Repeat PYQ. Right? So this question will come. See, this question will come like this. A patient has high transferrin saturation. He has high serum ferritin, bronze discoloration. He has diabetes also. So you will get to know he has hemochromatosis. Which organism will grow more in him? Or which organism is problematic in him? So they'll give you a few options, or a direct question can come. What are the siderophilic organisms? So these 3 especially learn the above 2. These 2 you learn, Vibrio and Listeria. Okay, everyone, giving you 1 minute. Please revise. Take 1 minute. Please revise. We are going to have a very short class today. Not at all a very big class. Because today I just want all of you to get acquainted to how we are going to study medicine. Okay, the microbes which grow, which love iron. Okay, siderophilic, they love iron. Vibrio vulnificus, Listeria monocytogenes, Yersinia enterolytica, but no need to remember the Yersinia. Remember Vibrio and Listeria, they are your most sought after questions. Untreated, you tell me, untreated patient is there, his heart is having a lot of iron. So what will happen to the poor heart? Congestive heart failure, CHF, heart failure. Right, bete? So even if you treat such a patient, even if you do not treat a patient, the patient doesn't have a good chance of living. Okay. So have you revised? Now you are not going to look into your notes. I'm going to ask you questions and you are going to answer. Okay? Rapid fire I want. What is going to happen to serum ceruloplasmin in Wilson's? Increase or decrease? Answer. Rapid. Like what was that show, Coffee with Karan? You are going to have medicine with Dr. Jasmine. Right? So that is like a rapid fire. Let's have it. Awesome. Next, transferrin saturation decreases in hemochromatosis. True or false? Do not look at the copy. If you look at the copy, then I fail. So I know you don't want me to fail. Right? Do not look at the copy. I just want all of you to answer without looking at the copy. Very good. Next, the investigation of choice for both hemochromatosis and Wilson's is very good. I'm looking at the answers. Very good. So I'm passing. See, beta, when I come to take any class, I come so that you all can learn. Right? That is my objective always, that you all should learn. So when you come to the class, your objective should be, I have to learn. If a question comes from this topic, I will nail it. Very good. Okay. Kayser-Fleischer ring is seen in hemochromatosis. Very good. Next. Very good. D-ferriprone is the drug of choice for acute iron toxicity. A person has diabetes, sudden onset diabetes, uncontrolled diabetes, tan bronze discoloration of skin. He has arthropathy with eagle beak like deformity of the hand. What is he suffering from? Wilson's or hemochromatosis? Drug of choice for विल्सन क्यों बोला बेटा? विल्सन थोड़ी होगा. ईगल डिफॉर्मिटी, आर्थ्रोपैथी. वेरी गुड. ड्रग ऑफ चॉइस फॉर विल्सन. ड्रग ऑफ चॉइस फॉर विल्सन्स. Very good. If zinc acetate not there, you can mark penicillamine. And drug of choice for this is desferoxamine or iron chelators. And the treatment of choice. See beta, drug of choice and treatment of choice are two different words. Drug of choice for hemochromatosis becomes the iron chelators. Treatment of choice is venesection. Okay? Please read the words carefully. Okay. The second last topic for today is the Budd-Chiari syndrome. Very easy. Budd-Chiari. Right? Such a sweet name. What is happening? Budd is happening. What is Budd? There is a vessel and a bud is happening. Bud is happening. That means occlusion is happening. Occlusion of hepatic veins. But how many? Two or more. Not one. Not occlusion of one vein. Occlusion of two or more hepatic veins. Right? So what is going to happen? Hepatic vein is done. Here I am going to give you a homework. You are going to learn the liver full blood supply. This is your homework. You are going to see all the ductal system. What are the ducts, the bile ducts, the pancreatic ducts, where do they meet, what do they form, everything. So the anatomical blood supply, anatomical ductal system of liver has to be on your tips, right? So beta, what happens when the hepatic vein, not artery, vein is blocked? We get hepatomegaly, ascites, and abdominal pain. What is ascites? I will teach you. Ascites is when water is filled up in the liver. Most common cause of this bud formation, this occlusion, is your thrombosis. Why will thrombosis occur? Because of polycythemia vera. Polycythemia vera. Important question. What is this? When there is a lot of RBCs in the body. So what happens? They start clumping together. They start clumping and they start forming a thrombus. And second important which you have to learn, both start with P, polycythemia vera, and PNH, paroxysmal nocturnal hemoglobinuria. What it is, ma'am? We will do when we do blood. Right? So, both the main causes, the other causes can be sluggish blood flow, pregnancy, infection, surgery, post surgery immobilization, whatever is leading to the sluggishness in the blood vessel. But for your questions, PCV is very important, most common cause. And next, if PCV is not in the option, PNH. So what do I do? How do I find out? Hepatomegaly is there, patient is having ascites, pain, abdomen is there, jaundice is there, so many things are there. So what do? I do an ultrasound. Right? And what do I do? Treatment. There is no drug for this because there is an occlusion. So I have to do surgery. I have to form shunts. I have to shift the flow of blood. What is a shunt? Suppose this vessel has occlusion. What do? I make a shunt. I give it another route. That is shunting. Right? Now let's take 5 minutes break. Budd-Chiari, 2 or more veins. Most important cause, PCV. PNH is also the cause. What happens to the patient? Occlusion of the hepatic vein occurs and there is a problem. Problem is ascites, jaundice, cirrhosis, hepatomegaly, abdominal pain, all that thing will happen. Okay? So this is Budd-Chiari. Important question which comes is 2 or more vein and most important cause. That is PCV. And homework, blood supply and ductal supply of liver. Okay, let's take 5 minutes break. Let's have water and then we will do some part of the next class. Okay, everyone, let us take 5 minutes break. मार्कर दे दो बेटे, मार्कर का है। Hello. Now, bete? Now audible? Okay, good. Okay, so what I was saying that there are, I just saw two messages, right? The two messages state, one is that yes, see, bete, Bush-T disease and with azathioprine drug, we can see this disease, Budd-Chiari syndrome, but it is not a very important question for you all. Second, the most common cause is PCV. Most common cause is PCV. If PCV is not in the option, then PNH. Second, first. Right? Got my point? Yes, beta, Dr. Mayuri, it is, but it is not the treatment of choice. Treatment of choice is different. Okay. Now, beta, let us come to something very conceptual. First, I want all of you to understand. Then you will write it. Then for the next class, you will learn it. For the next class, I want this particular topic to be on your tips. So let us first understand. Take a fresh page. Right? Let's start. I am going to write and you are going to understand. Right? And then you are going to write yourself. Now see, beta, we all know there is RBC, and inside the RBC we have hemoglobin, which is made up of this much normal information you have, which is made up of iron and and globin. Heme is iron. Hemoglobin, two words. When I break it, heme and globin. Heme is iron, globin is the protein part. Right? So when I break this RBC, the hemoglobin also gets broken down. Where does it break? It breaks in RE cells. Important question. RE cells, reticuloendothelial cells. If this is not an option, first option is spleen. It breaks down in spleen, but it also breaks down in liver and in lymph nodes. Right? So where do the RBCs break down? Spleen. If they say liver, lymph nodes, all of the above, all of the above. If they say where do RBCs break down? RE cells, blah blah cells, dada cells, RE cells. What is the most common or most important site of breakdown of RBC? Spleen. Right? Next. So suppose this is a cell of a spleen or a reticuloendothelial cell. Now when hemoglobin comes here, RBC is broken down. It gets broken into heme and a globin part. Fine. Globin is the protein, so it goes and gets stored in the protein pool of body. Fine. Please understand. Do not write. Now what happens to the heme? The heme first gets changed into a green pigment. What is that green pigment? Biliverdin. See, I'm making it green color. So it is a green colored pigment, biliverdin. Next, this gets converted to a yellow pigment, bilirubin. Yellow pigment. Right? Very important. Very important. First, heme, which has the iron, gets converted to a green pigment. Biliverdin. Heme oxygenase is the enzyme. Biliverdin gets converted to bilirubin by biliverdin reductase. Understood? Green pigment, yellow pigment. Now this bilirubin, I am calling it B, is very important. It is not joined to anything. It is just not joined to anything. It is not conjugated. That is why I call it unconjugated bilirubin. Unconjugated bilirubin. It is not joined to anything. Now, bete, few important things about the UCB. Number 1, it is lipid soluble. Okay, ma'am. Since it is lipid soluble, it can cross the blood-brain barrier and it can go to the brain. And if it goes to the brain, again, it is going to cause brain diseases. Correct? Kern icterus. Kern icterus. If it increases in the body, it can go to the brain, cause brain disorders, brain death, because it is lipid soluble. Second, it is water insoluble. It is not soluble in water, and beta, that is why it cannot be filtered from the kidney. So it does not come out in urine as not filterable by kidney. Anything that has to be filterable by kidney has to be water soluble and has to be not attached to anything. Right? Now, this unconjugated bilirubin, lipid soluble, can go to the brain, cause brain damage, but it cannot come to the kidney via the urine. It cannot come out of the body. Understood? Now, beta, next. This UCB is destroyed, the cells are destroyed, UCB is formed. This UCB will come in the blood vessel. In the blood vessel, there is a truck for it. Truck means a carrier. It is not going to bound, but it is going to carry it. And what is the name of this truck? Albumin. And as such, albumin also cannot be filtered by kidney. Right? So suppose kidney is there, kidney will say stop albumin. And everything that is attached to albumin will not be filtered. So 2 reasons why unconjugated bilirubin does not come out in the urine. Number 1, water insoluble. Number 2, it is carried by albumin, which is not filterable by the kidney. Now, from the blood vessel, everything will go to the various organs. So it goes to the liver. In the liver, this unconjugated bilirubin is conjugated. It joins with certain salts. Conjugated bilirubin is formed in the liver. Very important. Conjugation occurs. What is the enzyme that is causing all of this? Glucuronide transferase. Glucuronide transferase. Right? Now, some points about this conjugated. This bilirubin, number 1, is lipid insoluble. So, it will not go to brain. So if anybody is having conjugated bilirubin high, will not have brain symptoms. But it is water soluble. So it can come in the urine. Yes, बेटे Dr. Anurag, अभी I'll tell you what is curve nectar is. Neonatal है. Yes, I will come to it. Don't worry. It can, let us first understand the graph. Then I'm going to solve every question that can ever happen from this graph. Right? It can come in the urine. Clear? Flowchart is very clear. Now, from the liver, it will go to the intestine. What will go? The conjugated bilirubin. Right? In the intestine, via the bile ducts, it will enter the intestines. In the intestine, it will form stercobilinogen. Stercobilinogen. And this will come in the feces. So what give color to the feces? Stercobilinogen or stercobilin. Another thing which is formed is urobilinogen. Now this goes to the kidney and gives color to the urine. So what is formed? Urobilinogen, stercobilinogen. Okay, I will explain better. I will explain once people have written this. First make this much. Please write till here. So what is stercobilinogen?
Urobilinogen, a derivative of bilirubin, undergoes enterohepatic circulation, a process where
Okay. Next, everyone. Yes, I will, doctor. I will explain. First, right here, urobilinogen, stercobilinogen. Yes, it took the words. What is urobilinogen? And it started. Yes. So urobilinogen gives color to the urine. Stercobilinogen gives color to the feces. And where are they formed, Bete? They are formed in the intestine. Very important. They are not formed in the liver. They are formed in the intestine by the action of bacteria. Very important question. Right? How are they formed? They are formed by the action of bacteria. In the intestine, stercobilinogen, urobilinogen are formed. Now, this urobilinogen is of importance because urobilinogen undergoes something which is known as enterohepatic circulation. What does that mean? Entero means intestine. Hepatic means liver. Once urobilinogen is formed in the intestine, it can go back to the liver. From the liver, it can go to the kidney. So, circulation. Urobilinogen is formed in the intestine, goes to the liver, goes to the kidney. So it forms a circle, circulation. Whereas stercobilinogen is formed in the intestine, comes out in the feces. Okay, just you don't have to remember the whole cycle. Just you have to remember this word, enterohepatic circulation. Which substance undergoes this? The bile acids and urobilinogen. Okay, now let us quickly revise this whole cycle. What is happening? Hemoglobin is breaking down in the RE cells, especially the spleen. Very important question. Into heme and globin. Heme gets converted to biliverdin. Biliverdin gets converted to the yellow pigment, which is bilirubin. Bilirubin is very, 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 very important. Unconjugated, not joined. It is lipid soluble, can go to the brain in the babies, cause brain death. It is water insoluble, so it is never going to come in the urine. Right? This unconjugated bilirubin is also combined or carried by albumin. Albumin is not filterable by the kidney. That is why also it doesn't come in the urine at all, ever. Even if the brain and the body is exploding with UCB, UCB you will never find in the urine. Next, via the glucuronyl transferase, the unconjugated bilirubin is conjugated, right? And it becomes conjugated. It is lipid insoluble. It will not go to the brain. And second, it is water soluble. So it can. Now, the word which is important is it can. But now write down here, it does not. Like, for example, many students tell me, ma'am, I can get a seat. But the seat never comes. Because for the seat, you have to study. Can everybody can? I can do this. I can, climb Mount Everest. I can do anything I want in life. But the point is, am I doing it? Am I preparing myself for Mount Everest? Right? So, beta, can is not important here. It does not. Why? Why is a question mark? Why it doesn't? Because beta, in you and me, in a normal person, as soon as CB is formed via the bile duct, it enters into the intestine. As soon as it is formed, it enters via the bile duct into the intestine. So there is no time for it to go to the kidney. Right? So it can come, but it does not. When will it come? When there is more production of conjugated bilirubin. When will that happen, everyone? Suppose there is a stone in the bile duct. There is obstruction. Now, all the bile is only above. All the conjugated bilirubin is above in the liver. Now this will rise. This will not go to the intestine. And now it will come in the urine. It will make the urine dark. Right? Otherwise, in normal you and me, it does not. So, beta, normal urine, please write down. Normal urine has no bilirubin, any kind. Neither UCB nor CB. Reason are different, but I hope now they are very clear. Right? Next point, everyone. UCB in your question paper might come with a different name. Even in your lab report will come in a different name. What is the different name? Indirect bilirubin. And CB is direct. Now, ma'am, confusion. How to remember, ma'am? Unconjugated is a bigger name. Indirect is a bigger name. CB is a short name. Direct is a short name. Right? So no confusion when I'm here. You just have to learn as I teach you. right? So in the question it will be, will the direct bilirubin come in the urine? No. Will indirect come in the urine? No. Which can come in the urine? Direct. Correct? Please go by the language of the question very, very carefully. Right? Now, beta, this chart and your anatomy of liver, I want tips. I want all of this on your tips. By the next class that we are having, wherein we will be doing jaundice. And if you know this chart, where UCB is formed, where CB is formed, which is soluble, which is not soluble, which is going to the brain, which is not going to the brain, the jaundice topic will become like a piece of cake, right? So this is your homework before the next class, which is going to happen this week only. And we are going to do jaundice and going to start with hepatitis. Fine, everyone? Kya hai doubt? Any doubt? Please tell me. Correct, Dr. Anurag. Correct. Very good. Very good. Okay, Dr. Anurag, आप ही ने तो सब कुछ पढ़ाया है. देखो, I haven't taught you anything. See, medicine में nobody can teach you medicine or physio. I can only tell you the points and you have to connect. Right? This is going to be the medicine class for you, beta, wherein we are going to do pharmac, micro, patho, everything. And anatomy, I'm going to give you as a homework. Fine, everyone? So liver anatomy, half an hour. All of this 15 minutes revision, class is done. Okay, and coming to the first line, everyone. First line, I know liver is always interesting. First line, which is my favorite line from the movie Andhadhun. What is life? It depends upon the liver. Very true. You know, liver means the person who's living it obviously depends upon the person, but it also depends upon your liver. How healthy is your liver will depend, how long and how fast you are going to go in life. So for that, this 1 year, I want all of you to focus on your health. I don't want rank 1 to have no hair, right? Rank 2 who's having mental issues. Rank 20 and the friends are lost, the family is lost, and the person is actually having vitamin B deficiency, vitamin D deficiency, pain. No. We are going to become toppers with a good physique, with not just 14 hours of sitting, 1 hour, half an hour of good healthy workout. And beta, I know you are young people, you're going to eat outside, but lessen that thing. You eat outside, it's okay, but don't overdo it just for the sake of exam, right? Because if you fall ill, if you get hepatitis, you are going to lose 1 month of your preparation. Food poisoning, 1 month, 1 week of your preparation, right? If you do not wear masks and you're going into the OPDs, you're going to lose at least 4 days of your preparation. Don't do that. Fine? Whatever you can to safeguard yourself, you are your asset for this 1 year. Protect yourself. Right? Half an hour exercise is mandatory. You have to do. Even if you are at home, you are sitting for 15 hours. I want half an hour walk, nahi chahiye, exercise. No gymming, nothing, just exercise. Do any aerobics, dance, or anything you want to do, just do it. And only good food in your mouth. That's it. Correct? Chalo, best of luck. We'll see you again this week. Not next week, this week. And if the homework is not done, if the quiz you are not able to answer, then I will suggest you please go back, study, no class. Please watch it on a repeat then later. Okay? Bye-bye. 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 Powerhouse, Dr. Anurag. Thank you. Yes. So I want all my kids to be live quiz will start soon this week. We are meeting for the quiz. Topic is bone. Bone disorders, oral pathology, very easy. Very easy, very easy, very scoring. We are going to do diagrams and everything. So let us meet for the quiz. Yes, I'm going to pose certain questions. Answer kar do jaldi jaldi. Okay? Bye. Get ready for the exercise. Bye. Bye, 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 bye. Take care.